Hey moms, would you like to feel better and have more energy? Here are 12 ways to make mom happy. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical right here in Amarillo, Texas, and I'm here to talk about moms. Moms in pain specifically, and there's lots of moms having a hard time getting around and getting through their days and playing with the kids. So share this video with them and let's see how many moms we can help. Less pain and more energy. Isn't that the golden nugget for everybody? Well, of course it is. But how can we accomplish this state of feeling better and getting more done with more energy when we are so bombarded daily with life and, let's be honest, father time? Many times I ask my patients what they do for a living, and the common answer from some of the moms is, "Oh, I don't work, I just stay home and take care of the kids." And I'm like, whoa, 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 whoa. I let them know that I've seen their job, and it's not a job that I could do myself, okay? I'm just going to be honest. It's most definitely work, a lot of work, and it really is. Being a mom is tough, and without anything else piled on top of it, all by itself, it can be rewarding, but can also be draining and very tiresome. So life comes in waves, and its peaks and its valleys, but at some point, usually around middle age, we are getting piled up on with bills and money concerns, job security or lack of, teenagers and their baggage, our pet needs to go to the vet, the school called, the husband's boss has been acting funny lately, gas prices are too high, my sister wants to come to visit, and what am I going to get my mom and dad for their anniversary this year? Sometimes it's all of that and much, much more. And one thing is for sure, not all days are created equally, right? And then throw a global pandemic into the mix and wow, life gets complicated. It gets stressful, full of anxiety and worry. And these things have a way of making a mom tired, and we know anxiety, stress, and worry are key culprits in deepening and worsening chronic pain. So let's start there. What does research tell us about treating chronic pain? And then we'll discuss boosting energy levels. So let's start with 6 ways of addressing chronic pain. The first one is sleep. Sleep has been shown to be one of the best pain and anxiety relievers in the world, and it's free. The benchmark is 8 hours, but a recent research project showed us that those increasing their sleep time from 6.5 hours per night on average to up to 8.5 hours per night had significant reductions in pain, depression, anxiety, and everything else that goes along with it. And that's a pretty big deal. Next, you gotta move. Okay, you have to move. Our natural thoughts when we hurt are to be still and protect ourselves from more pain. And the reality is that movement is healing and motion is the lotion for our joints. When you back away from activities, you start deconditioning almost immediately. So rather than protecting ourselves, we should be leaning into the pain and activity while understanding that there's a difference between hurt and harm. Hurt very rarely means harm, so we need to get moving. Now, if it feels harmful, dial it back just a bit, but being sedentary is not an option, folks. Next, the American College of Physicians, their very first line recommendations for acute and chronic low back pain are as follows: spinal manipulative therapy, exercise rehab, massage, acupuncture, low-level laser, low-grade medication if desired. I'm pointing at myself because we do all of that right here. And then there's yoga, tai chi, and cognitive behavioral therapy. Those can all go in as part of a broad management protocol to help solve chronic pain, and we can do it all here, except for yoga, tai chi, and cognitive behavioral therapy. But we know folks who can do that. So next is trigger point injections. Our nurse practitioner here can find the sore and knotted up muscles and get them to settle down and release them with trigger point injections. And no, it does not hurt. We use numbing cream, so most just don't feel a thing at all, except for less pain. Of course, you feel less pain. And then we've got joint pain that we can treat, right? Joint pain can be helped with PRP injections. A series of 3 injections over the course of 3 weeks has been shown to beat cortisone and hyaluronic acid injections in several randomized controlled trials. And PRP doesn't tear up the joints as cortisone does. And then pain education. In the case of chronic, long-lasting pain, pain education is vital because the first step to treating chronic pain is understanding it. And this part cannot be overstated. To beat chronic pain, patients must play an active part and do some work on their own to understand it and learn to turn the dial down on their own at home. And we can help you with that. So again, of those modalities put forth by the American College of Physicians to treat back pain, here at Creekstone Integrated Medical, we offer 6 of them right here under one roof. So we got you on the pain. All right, now that we have solved your chronic pain issues, let's turn our attention to energy. 6 ways of addressing your energy levels. Let's start with lab tests. Understanding why a patient has low energy levels, well, that makes sense to start with some lab work. Testing patients' blood can tell a medical provider, like our nurse practitioner here, lots of things about what may be happening inside your body. Patients sometimes have simple issues like vitamin deficiency that can be very easily corrected. And sometimes it's more complicated, but addressing them rather than ignoring them can get you on the right path much quicker. Next is exercise and movement. Where have you heard this one before? Movement and exercise, they're not only good for reducing pain like we spoke about, but movement is also excellent for boosting your metabolism and your energy. The more you move, the more you're going to want to move. Confidence, a feeling of health and well-being and less pain and more energy are only a few of the wealth of benefits patients get from movement and exercise. Now, the next is hormone balancing. This is huge, folks. When it comes to being tired, having brain fog, a lack of libido, and headaches, and that's just naming a few of the issues, one of the first things that you can look at to turn things around is hormone replacement and balancing. Our nurse practitioner here at Creekstone is a medical provider and qualified to perform this function for you. Optimizing hormones can be done very simply these days. A simple blood test reveals hormone deficiencies, and if needed, a simple 15-minute little procedure can optimize a patient's hormones for 3 to 4 months for a female and 6 months for a male. Along with some monthly supplements, this literally changes lives, especially for moms that have gone through a hysterectomy or menopause, as well as for older men with low T counts. Next, for energy, we've got IV hydration and vitamin optimization. IV therapy is the newest and best treatment available to deliver vitamins and nutrients directly into the blood system effectively and efficiently. You get to choose the IV mixes, and they can be for brain health, anti-aging, energy boosters, immune system boosters, recovery from illness, just simple rehydration, or a whole host of other issues. But the point is, IV therapy is a fast and efficient means to treat a lack of energy. It's excellent. Next, we've got B12 shots. If patients are deficient in B12, our nurse practitioner can prescribe B12 injections to help boost energy and reduce fatigue. B12 deficiency can lead to lots of issues like difficulty thinking or remembering, fatigue, and much more. So sometimes B12 injections are just what the doctor ordered. Next is weight loss. This one goes without saying, really, but a patient will gain back their desired energy levels just as soon as their bodies are allowed to stop working so hard. And when we carry excess weight around all day, every day, we wear out faster. It makes sense. And not only in our backs and joints, but in our level of energy. So think about it. How would it feel to carry around a 20 to 40 pound backpack or heavier all day long, every day, even sleeping with it? It's exhausting just thinking about it. So we have a tailored, straight from the pharmacy, medical weight loss protocol here at Creekstone Integrated Medical for our patients that need it and want it. So there you have it, Mom. I have given you 12 easy ways to get started on the path to reducing your pain and boosting your energy, not only for yourself, but for your family. Because the saying is well known for a reason. When Mama's happy, everybody's happy. So call us here at Creekstone Integrated Medical at 806-355-3000. Let's start making Mama happy again. If you're watching us on YouTube or Facebook, subscribe, share, and comment. All of it helps us spread the message, and you know moms are hurting, and you know we can help, so be sure and tell them about us. Again, I'm Dr. Jeff Williams with Creekstone Integrated Medical. Thanks, and until next week, be safe. We'll see you then.